Good evening, everyone. I'm Dr. Jeevan Velaidam, ENT Master's Trainee from Pusat Probatan University, Malaya. So today my rapid-fire oral presentation will be on patient-specific titanium implant, post-maxillectomy, the evaluation of surgical reconstruction. So, as we all know, malignancies rising from paranasal sinus account for just 0.2 to 0.8% of all malignant neoplasm and about less than 5% of all head and neck cancers. And squamous cell carcinoma involving maxillary sinus is the most common malignancy which requires maxillectomy. The surgical treatment of these tumors often consists of a subtotal or total maxillectomy with a significant defects. Besides, the proximity of the maxillary sinus with the complex anatomical structures make this reconstruction a major challenge for the head and neck surgeons. So the objective of my study is to highlight our surgical management and reconstructive method that we used in maxillary sinus cancer. So basically the management of maxillary sinus cancer in our center, so it actually depends on the staging. So in our center we use a multimodality treatment, so where we do a total maxillectomy or a subtotal maxillectomy, and of course when there is a nodal metastasis we will do a neck dissection, and of course when there is a significant defect we will do a primary reconstruction with either a distant flap or a free flap, and also depends on the staging as well. We'll decide whether the patient will go for an adjuvant therapy or not. And some centers they also practice a new adjuvant therapy before they proceed with a surgical resection. So here I'm going to present two case reports on a 69 and 53 years old patient diagnosed with maxillary sinus squamous cell carcinoma, both of whom underwent a total maxillectomy and reconstruction with patient-specific 3-dimensional printed titanium implant and temporalis myofascial flap. And both these patients actually diagnosed with stage 3 SCC. So if you look at the figure 1 and figure 2, this is the first, we just did the surgery like 2 months ago and the patient is currently ongoing radiotherapy. So you see at the figure 1, this is the reconstruction with a temporalis myofascial flap. So and then we reconstruct with a titanium implant where we prepared the titanium implant using a computer-aided like a medical software program. And figure 3 and figure 4 belongs to another patient 6 months post-therapy, where we can see the post-operative aesthetic defects it's actually after 1 year. So if you can see, the patient actually has recovered well from the surgery, and she also has completed her radiotherapy, and she has a very good functional and aesthetic outcome. So the conclusion is patient-specific 3D printed titanium implant and temporalis myofascial flap is a promising technique for reconstruction post-total maxillectomy with satisfactory functional and aesthetic outcome with minimal complication. So, thank you.
Thank you, Dr. Jeevan. Does anyone have questions for Doctor?
Hi, is there a certain reason why you chose titanium specifically?
Okay, so previously we have also used a mesh implant. The reason why we use a titanium is because it fit well and fill the gap. So another thing is because of the mesh can easily malleable, and if you use a titanium it's more solid, and it also gives a very good aesthetic outcome with maxillary prominence and all that. So that's the main reason. And of course, it's not really cost effective for many of our patients, but those patients who can afford, so of course we give an option of titanium implant.
Else?
Yes. Titan.
Okay, just a comment. I mean, maybe you can put up the title as a case series to give more clarity for the your prospective audience. Thank you.
Sure, noted. Thank you.
Thank you for the suggestion, Doctor. Anybody else? If no, we can proceed with the next presenter, Reno Tan, talking about the role of PNMA